Perfect. So we are all set. The limit on Zoom has already been met. And here we go. We have many people joining us on Facebook Live right now. Mm, Sorry, ma'am. Do I have your
Yes,
permission?
yes, yes.
Perfect. So, hello everyone. Namaste and welcome to today's session. As you all know, my name is Ravi Santlani and I'm the founder of School News, India's largest media platform for the education sector. We have over 2,178 attendees registered for this webinar and are live with us both on Zoom and Facebook. Thank you all for your interest. A big thank you to Early Childhood Association India for making today's webinar happen. Today's topic is global impact of COVID-19 on early years education, and the speakers are going to discuss the solutions in way ahead. Today we have what we call a dream panel of celebrity speakers from across the globe. All thanks to Dr. Swati Popadwats, who made this possible. Fun fact, if you haven't noticed yet, I am the only man on this panel surrounded by these very beautiful and famous icons of early childhood education. And let me tell you, a few of you that jealousy is not a good thing at all. So here are the today's esteemed speakers for you. First comes our very own panel chair, Dr. Swati Popadwats, who is also the founder president of Early Childhood Association India, also president of Association for Primary Education and Research, APER, also the president of Podar Education Network, where she leads over 498 preschools and daycares as founder director of Podar Jumbo Kids. And we all, with love, call her the mother of early childhood education in India. Then we have our very own Claire Warden from United Kingdom. She is the CEO at Claire Warden Limited and Mind Stretchers Limited. She is also the founder of the International Association of Nature Pedagogy and Living Classroom Associations. Professor Karen Graham from Wales, UK, who is Emeritus Professor, Childhood and Family Studies, Glendower University, Wales, UK. Laura Henry Allen from United Kingdom is joining us today. She's an international speaker, writer. She's also the creator of JoJo and Grand Grand Characters and consultant. She also serves as the vice president of the British Association for Early Childhood Education and also serves as a consultant to BBC and Penguin Random House Global Publishers. Joining us from Australia is my mate, Sam Page, the CEO of Early Childhood Australia, and also serves on board of Perinatal Anxiety and Depression Australia, short form PANDA. We all love pandas. Yeah. From the United States of America, the country of Trump, presenting Stephanie Olmore, who is the Senior Director of Global Engagement at National Association for the Education of Young Children, NAUYC. We all know NAUYC, and we were supposed to travel to US for NAUYC conference. Swati ma'am kind of convinced me, and I also allocated some budget for that, which we are using on pizzas and booze these days, by the way. Thank you, Stephanie, for joining us. And welcome, ladies. Before I hand it all over to Dr. Swati, I'd like to share a few points with all our attendees, both on Zoom and Facebook Live. If you're facing any bandwidth issues, we suggest that you turn off the video so that you can listen to the audio with a better clarity. A recorded version of this webinar will be available on our Facebook page, School News, and at Early Childhood Association's Facebook page. And we shall also send you an email with the YouTube link post this webinar. You can follow all the lovely ladies and, of course, me on our Facebook, Insta, and Twitter accounts and interact with all of us there if you have any questions post this webinar. For those of you just joining, welcome, enjoy the webinar, and hello from India. Over to you, Swati ma'am.
Thank you, Ravi. And Ravi has been a real committed educator, I would say, because he has done so many webinars on early childhood, because we didn't want early childhood to lose its focus in this entire lockdown period and with what every country is struggling with. We wanted to keep early childhood at the top of all the topics being discussed. Thank you, Ravi, for always supporting early childhood education. And I am on a phone, so I can't read that. So you'll have to help me. Oh, how sweet. I think this is how the youngsters do it. Am I doing it right? Yeah. So, Laura, thank you so much for joining us. You are fresh from the victory, or I would say the success of having your storybook converted into an entire series on BBC. And that's such a lovely achievement. I know you are feeling a little under the weather. So am I. So let's just keep our fingers crossed, and we need all your prayers and blessings. Claire Warden is our lovely kindergarten in the outdoors lady. She is our forest kindergarten queen. And we had her last year here in Jaipur. Stephanie, also we had the honor of hosting her last year, and she met all of us at ECA. I went then to NAYC, and we were supposed to go again to NAYC this year, and I hope that happens. Sam, my Aussie friend, if you can see behind me, there's a kangaroo which I picked up from my Australia trip this time. And we were actually supposed to host her in February in Kerala. And I think, Ravi, we should congratulate ourselves because we were the first ones to cancel a conference because of Corona way back in February.
Yes.
And I think that was real quick thinking. And we must have saved hundreds and thousands of lives by canceling that conference at the time at which we did. A lot of people were disappointed. In fact, Ravi and I were going to announce the new date, and then we said, hold on, let this Corona thing die down before we give a date and again disappoint the participants.
Well, let's try to next.
Yes, absolutely. Karen is our child rights activist, and Karen came years back to help us with the Born Smart project. She's an expert on the Born Smart website. And it's such a pleasure, ladies, to have you all here for this discussion on how COVID-19 is going to have an impact on early childhood care and education throughout the globe. So let me give you a little brief to all the listeners who I know are all going through the same. It started somewhere in some country, I don't want to name it. And everybody became a little conscious about hygiene, about washing hands. It wasn't that serious in January, or maybe it wasn't announced to be serious because we had taken an educator's pilgrimage around the world, and thankfully we were safe. But when it came close to our conference in February, everything became topsy-turvy. Kerala got its first few cases, and an emergency lockdown was declared there. And the world then started picking up the virus. International travel was stopped. In India, of course, schools started taking more care first. It was all about maintaining hygiene, cleaning the school. And then it came down to asking the children to stay home. The staff were still working in the schools, but the children were at home. Lockdown was announced, the first lockdown, and everybody had to work from home. Everybody who was, giving all kinds of bad reports about digital learning suddenly embraced digital learning, and everything online was suddenly wonderful. And schools had to suddenly bring out all their stock and think about how to send all these activities online, which is the right platform. Is it Google? Is it Zoom? Is it what? So this kind of frenzy took over. Parents were clueless because children were going to be at home for 24 hours, because in many countries like India and the UAE, nurseries, which means daycares and kindergartens, were closed, which I believe are quite open in the USA, in Australia, and in UK. So that is something very important that we are going to be discussing, that how are you managing with your littlest children out there? How is the staff managing? How are you keeping them away from COVID? And are you planning to close it or not, etc.? It's very important that now, as we move into our second lockdown in this country, suddenly all of us will have to remove a new rabbit from our magic hat, because I'm sure all the online ideas that we have worked on will slowly start becoming repetitive, will start becoming boring. Children will start missing their teachers and school and the outdoor a lot more. So those are some of the points that are going to be discussed here. Anxiety is rising now, especially in children. Are they ever going to go out again? Will they ever see their friends? In fact, there is anxiety in the adults too, that is this the new normal? Are we ever going to be getting back our normal world again? That's a huge anxiety in adults. When will things reopen? When will we see everything open? I'm sure all the countries, when they come out of lockdown, are not going to just suddenly open up everything. It's going to come out in phases. And I don't know when international travel will start again, or will it take a lot more time? And what will be the difficulties that we will face when we reopen? These are some of the questions, some of the anxieties, some of the queries, the doubts that are in everybody's mind, in every educator's mind. And that's what we are going to have in this discussion. My first question to all the panelists is going to be that how has your work changed in this entire COVID-19 period, right from the onset of COVID-19 to the lockdown now? How has your work changed, and what are you doing during the lockdown? So we'll start with Laura. Laura, how has life changed for you?
First of all, thank you very much for inviting me on this panel. It's an honour, and to the colleagues for organising. For myself, as you said, from around January was my last international visit. I was in Costa Rica working with an international school. And then likewise with every other country, it was make sure you wash your hands, etc. And it was a trickling thing. And then we went into full lockdown about a month ago. So myself, whereas, you know, because I've been over to India, I've worked with you guys over there, I've been very busy supporting head teachers, daycare owners on what are they currently doing. So just providing a listening ear, because all of my face-to-face work has stopped naturally. So I've been doing many online Zoom chats, telephone conversations in the UK. The government is churning out legislation day by day, what they're doing with their staff teams. A lot of nurseries and schools are doing online learning, but for me, that's not working. I'm not doing anything online because, as you so rightly said, there's a lot of anxiety. People are worried about themselves. People are worried about, somebody's just put a message there that they can't hear me. I'm not audible, but you can hear me. Yes. Can you hear me? Can you hear me?
Yeah,
yes.
maybe closer to your laptop.
Okay, yeah. So I think with regards to that, for myself, and I've been writing blogs, I've been doing many international Zoom chats with colleagues in the States, in the UAE, also over in China. Every 2 weeks I'm hosting an evening Zoom chat called Snuggle In, when anybody can join in and there's no agenda. People are just talking about their feelings, offering support. I did another session with colleagues in Scotland where we talked about the kit bag approach, which is an approach we use where we talk about our feelings first, which I believe is very, very useful way to start our connections, because we can't physically, you know, be with our loved ones and with our colleagues, but we can start off our conversations as a simple thing. How are you feeling today? And myself, I'm actually in lockdown by myself. So there's challenges there. My oldest son's autistic, but he lives 10 minutes up the road. So that's a personal thing. My mum's elderly as well, so she can't have anybody in visiting her. So I'm just supporting daycare and school as much as possible. And in your opening speech, Swati, you mentioned in the UK, we still have some daycare, nursery, preschools, childminders and schools opened. And what the government has said is that they're only to be opened for key workers. So under that key workers bracket actually comes other teachers, hospital workers, and also too for vulnerable children. So these are children who may be known to social services because they may be safeguarding or child protection issues. So for those particular nurseries and schools, it is quite challenging that they're opening up. But I know as the weeks have gone by, many of my clients, nurseries or schools, have contacted me and said that they've had to close because they only may have had one child. And some areas are developing a hub system where a group of daycare or schools come together and then they actually host those children. As you said, there's many online support where teachers are doing things, celebrities are doing things, dancing, maths, etc. that they're doing. I've been involved with doing some activities for my colleagues who are academics and head, and it's called EYFS at Home for children between 3 and 5, and I can pop that link into the chat for colleagues to see, and that's based on literacy. We're talking about families, etc. So I believe
So
there are
basically the schools and the daycares are open for the essential services staff, right?
that's correct, yes. Yeah.
Because in many countries like India and the UAE, we have closed down everything where children are concerned. And I think we have joint families, so maybe the children of these essential services staff are taken care of at home. But I think there in your country, in Australia and in USA, this is something that is still kept active. So are you not facing any issues with that?
Yeah, I think there's a lot of concern because obviously from the teachers and the educators' point of view, they're worried about their own health with regards to that. They're worried about going back home if they've got anybody who have a secondary illness, for instance, diabetes, a heart condition or cancer. And so there is a lot of chance. This is why one of my daycare providers who's got multi-sites decided to close down, because many of her staff had anxiety and she was dealing from it from, you know, a long distance, trying to support her head. So she decided to close down. But there are a number of nurseries that are still open that I'm still supporting with their staff, albeit they're not open to full capacity. So it is and it is very well needed because there are so many key workers out there in terms of people working in the fire service, ambulance, hospitals, train drivers, all of the government who was stated who are essential key workers. So it'd be interesting to hear in India, because I know I've spoken to some of my colleagues in the UAE, what are happening to those key workers' families where there's no daycare or there's no school. What are happening to their children when they have to go out and provide an essential service?
So basically, as I said, in India, families, neighbors, friends are taking care of them. Some hospitals have even set up a daycare because many of these doctors are not able to go home at all. Some of these doctors have spouses which are not in the same field, and everybody's working from home. So it's the spouse that's taking care of the children. So I think that's how it has been worked out. Claire, coming to you, how has your work changed? Because you work with nature kindergartens. So has your work changed or is it still the same?
No, I mean, it's definitely changed. I think most of my work, as you know, has been international. I think there are lots of different facets to my work, and about 10 years ago, my husband and I had set up a charity called Living Classrooms. And one of the things about Living Classrooms is that it uses the natural world as a place really to support emotional harmony, to work with marginalized groups. So when we realized that actually that this was going to hit, and you were hearing ripples of it all over the world, several things had to happen. One was that the Living Classrooms not-for-profit, the KIC, if you like, the community company, then emerged out of the basis of Mind Stretchers. That means that we had to start looking at how we could help people in our local community. So Cologne Nature Kindergarten is a hub that Laura was talking about earlier on. But I think as a leader in that space, it would be wrong of me to have that centre and actually say to my staff, I want you as objective people to go and now work with children of key workers if I wouldn't model that myself. So I now volunteer. We have a pop-up nature school, and that runs with children from essentially from 2 years old to 5 years old in the nature kindergarten. And then I now work with children from 5 to 11 years old.
So how do you ensure that these children are safe? How do you know? Because COVID-19 takes 14 days to show its symptoms.
Absolutely.
So aren't you worried about the children?
I think when we started to make that decision about going forward to be a hub, I think you have to give everybody the human right to say they are ready or not to take up that mantle. I think we know the needs of the children that are at our setting. I decided, and those other people who are working with me decided, that this was something that we felt we wanted to do. That meant that some of our team are what you call furloughed, which means that they are still paid by the government for 80% of their salary, but they stay at home, whereas the rest of us have decided to go in. So we have increased hygiene. We are outdoors, which is one of our greatest strengths. So actually for us, we spend a lot of time very far away from children. So we, I think, benefit from being in the natural world. I think the signs that we're finding from the research is that the cross-contamination in a natural space is far less than you're going to find on a white, clean surface in an indoor environment. So when you're examining what is the risk, it's far less when you start to read the research about being outside in the natural world than it would be in one that is more man-made, more urbanized, if you like, because of the surfaces that we're engaging with. We're further away from children. As yet, we are classified as what we call a low-risk environment. However, we do have families where we've now got 3 or 4 children where both parents are working in frontline work. And it means that for those parents, some of them are living apart, which is what you talked about, Swati.
Yeah.
And so not only are we dealing with the issue and sense of threat that children feel, they are in a place of disharmony because all of a sudden their family structure has completely changed. So for us, we work a lot around what we call the raft. And so the raft for me is about developing that emotional resilience, whether it be with adults or with the children I'm currently working with. So we have the reconciliation that this will end, is the R. The A is the affirmation that for most of us going through this crisis, this pandemic, we are going to be okay. There's going to be an affirmation that people will love the child, that they will be cared for, because for some children, it becomes a place of real uncertainty. And the F stands for forward thinking. This will end and we will go back to something. It won't be the same. And in some cases, that's a good thing. But forward thinking means it will end. And T is together, that we are in this as a community, as a harmonious little group of people. And so for them, it is about them feeling joy, that they are sensing that. So what happened after we'd done the pop-up nature school, as we call it, we then were approached by people to do a virtual version of a nature school, which is actually really interesting for me because I spend most of my time saying, get off the screen and go outside.
Yeah,
I'm now
exactly.
Here's that tension for me as an academic, where I've been writing about nature, to examine, is there a relationship between the idea of putting the natural world through a screen, and is it even possible? Because what we're finding is that all of these bright ideas, Swati, they're reverting to a pedagogy, a way of working with children, which is didactic. So here's your idea, you do this idea, and that'll be great. And so those ideas are going to run out. So we then created this idea of an inquiry-based approach. That's what we're all about. It's very much, it runs for 5 days. It's not a bright idea. It's built around the natural world as an inquiry into shadows. And I've just come from doing a session on cubbies and settlement and community. So you have these 5 days of supported, if you like, work with families in the home environment. And those are loving because you're seeing families almost and parents feeling they've been uplifted and supported to go forward on this journey with their children. And I think you're right, Marty. I think sometimes there's this incredible tension for people that all of a sudden they've been put into a place where as a parent, you've got, and I'm with teenagers, all of a sudden I'm in close proximity with people who I don't normally see that much of. And so for all of us, we have to dig deep and go, okay, it's fine, that you leave that stuff over there. And so parents, I think, all over the world.
So much of adjustment.
Oh, so much.
Coming to Stephanie. Stephanie, USA is right now going through a very, very critical period. There have been so many cases, so many deaths. How is NAEYC supporting the early childhood community in the USA? And are childcare services still on there?
Yeah, it's been a really difficult time in the US, and I think what it's really highlighted is the inadequacy that we have in our early learning system here in the United States. And that's difficult for everyone, but particularly for those who are most vulnerable in our population. And so it's been a very difficult time. Our role, so we've all gone online. I think, you know, the vehicle for our work has shifted, but our commitment to advocacy, and particularly around advocacy for early educators who are in classrooms or who are small programs running childcare centers, this is just been unbelievably difficult for them. So we have done a couple of things. I mean, one, you know, I will say there was confusion when they started closing schools. They closed our K-12 systems. And in many states, there was sort of this question, well, childcare will just keep running. And we came out very early on to say, look, you know, there's health reasons. This is, you know, the pandemic really is not it's not safe for us to be running childcare and have that open as is. We do recognize that there are essential workers, much like the others have mentioned, that do need support. And I do think because of the way our society is set up, it's much more difficult to rely on family or even neighbors to do that. So there are many programs, we call them programs, that are still open. You know, the Center for Disease Control has provided some very specific guidelines around how they should be interacting. We would say again that there are, you know, only if you're serving essential workers. I do think here in this country, what's interesting too is that we still can go to a grocery store, right? So we're looking at grocery store workers are also essential workers in this. And these are people who are, you know, generally fairly vulnerable because they're not making a lot of money. And so that's really important that they have that flexibility. So what we've said is there's a couple of things. One, do not change licensing rules that already exist, and don't just come up with new programs. That we have skilled childcare workers who understand how to run childcare programs, and we should be figuring out how to use those to maximize for essential workers, so that we're not just creating something and nobody, you know, it's brand new and there's no monitoring or history of understanding early learning. So that's one thing. I think the other thing that's been really critical with our work is advocating for the educator, because in this country, many childcare workers don't have health insurance. They don't get good sick time. So those are absolutely critical things, particularly if you're serving essential workers. You have to be able to say, I'm sick and I'm not coming in. So there's a number of policy supports that we have pushed for that include everything from this childcare program who had to close because in fact it wasn't healthy and they're not serving essential workers. How will they come back? Right? That this is really difficult, that we don't have, they've had to furlough staff, they don't get their salary. So are there ways that loans can support, can we get them to be able to pay for childcare, their childcare staff for a couple of months? Again, healthcare is a huge issue. So making sure that they have access to the healthcare they need. And I think we're navigating what this will look like when we come out of it, right? That we're still sort of in this crisis area. It has brought to light the importance of childcare as you know, childcare workers as essential, that in fact they are. I would say the other thing we are advocating for is that if childcare workers are working, they should get hazard pay, right? So that's another thing that's coming up, because these are frontline workers that are at risk, right? Their families then become at risk. So how do you really highlight what they're doing and ensure that they're safe? But as hard as it is, I do think it's an opportunity to, again, really, parents are home with their kids. So the other work we're doing is sort of taking our developmentally appropriate practice content and trying to package it in ways that parents can really access it and find ways to interact with their children in high quality ways. And I think it's really giving us an opportunity to show how important early educators are and the importance of this profession.
Absolutely.
It's tough, but I do think when we come out of it, we may have the opportunity to really spotlight the critical work that early
Yes.
educators do every day.
Absolutely. You know, being a member of both NAYC and ECA Australia, I see the amount of policy work that you are doing with the government, which is really, really commendable. In India right now, it's not the government that pays the salary. So it's the school owners who are going through a very tough time because fee payments have stopped and you still have to pay salaries to your staff. So the school owners, the daycare owners are all going through a huge crisis. And we also have scheduled another webinar next week to discuss the Indian scenario and how people can get out of this, what is the way forward. But coming to you, Sam, I have seen you also do a lot of advocacy during this time. How have things been in Australia?
Confusing, I think, would sum it up. So we have a mix of approaches across different jurisdictions. So different states and territories have taken different approaches in terms of schools. So some jurisdictions closed schools to students very early on in March. Other jurisdictions still have schools open and operating as normal. And that's created a lot of confusion for parents with young children attending early childhood services because they don't understand why the early childhood service is still open when the school is closed, or vice versa, why early childhood services are reducing capacity when schools are still open. And so there has not been a really consistent message for parents about whether they should continue to send their children to early childhood services or not. And there's been confusion in the sector. And early on, our advocacy was about, if there's a national shutdown, how do we protect the jobs of educators and the infrastructure of services so that they can start up again at the other end? And we were all anticipating that there would be a shutdown, that services would close, and what we needed to do was put everyone in a holding pattern until we came out the other side. And then as time went on, we realised the government did not intend to shut early childhood services, in fact, quite the opposite. So their policy decisions have all been about keeping services open. And most recently what they've done is told services that they're not allowed to charge families any fees at all. And they're given approximately half the amount of funding that they used to get, and they must stay open to receive that funding. So that's a very strong message to services, that they have to stay open. And then the argument being that they must prioritise families of essential workers. And here again, we have a complexity, because sometimes the term essential workers is used to mean hospital workers and health workers and grocery store operators and transport drivers that are essential to us all having food to eat and hospitals to attend to the sick. Other times, the Prime Minister has defined essential workers as anybody with a job. And so there's a lot of confusion amongst families. Again, am I an essential worker? Do I get free childcare now? And we've been on this kind of roller coaster ride where we had families with keeping children at home, but still being charged fees for the service that they're not attending. Then they got cross about that. In fact, they were very angry at the operators, a lot of families saying, you should be closed, you shouldn't still be open, and you shouldn't be charging me fees, and I'm not attending. So then they started unenrolling their children. And so then centres started to crash because they were losing the families and losing the capacity to charge the subsidy. Complicated system here in Australia. You can't charge the subsidy if you can't charge a fee. So they were losing all their income. And for outside school hours services in jurisdictions where the schools were closed, they lost 90%, like in a matter of 1 week. They went from 120 children to 10. And so there was a panic then that services were going to fall over, they were going to close, and small business would go bankrupt, and NGOs would walk away and say, we don't want to do this anymore, it's too risky. And so the government came in with a relief package, which was this funding arrangement where you get half of what you used to get for subsidy, and some wage subsidy funding as well, as long as you stay open and prioritise essential workers. So that's kind of where we're at the moment. And we still have a lot of families keeping children at home and saying, no, they're not going to send children. And we do have those anxieties. A lot of educators feel very vulnerable that they're being asked to continue working and putting their health and the health of their families at risk. And there's a lot of discussion about the ethics of that in Australia at the moment, in terms of, I mean, certainly it's very clear anyone who has is vulnerable themselves, has an underlying health condition, or is in a higher risk group, or has someone in their household who's in a higher risk group, should not be at work. But for the broader population, it's less clear. The government keeps reassuring us that the health authorities are saying that early childhood services are not high risk places to be, and in fact that it's safe for children and educators to be there, but that's not consistent with the public health message that is saying don't send your children to school and don't go to the playground and you don't leave the house. And interestingly, you're reflecting on some of Claire's comments. I think it's been a pity to see services feel like, on the one hand, they're operating with a smaller number of children and they're spending more time outdoors and they're trying to create distance between the children and educators. But on the other hand, they've got this real mixed message about you're not allowed to have any non-essential travel. So you can't go to the natural environment that you might have been going to on a regular basis. You can't walk across the road and go to the nature reserve that in the past has been, a big part of the program. So there's some really mixed messages and confusing stuff going on here. I think one of the advantages for Australia is we do tend to have big outdoor learning environments, so we can spend time still outdoors, even if it is still on the premises of the Early Childhood Centre.
Oh wow, this is really, I mean it's such diverse ways of handling all the countries are presently having. So this is so diametrically opposite to what countries like India and UAE are doing. Where childcare services were the first to be shut because they felt children are at the most risk, and essential workers were basically supported by their families and friends. So this is something, takes a lot of time for everybody to understand how each country is handling the early childhood sector. Like for you all, UK, USA and Australia, you're funded by the government. India and the UAE are not funded by the government. So it means it's the person who owns the childcare center who is now bearing the burden of salaries, of rent, of electricity, etc. So it is such a so different scenario in which all of us are right now struggling and surviving. Karen, when we talk about you, I always think about child rights. And how do you think the affluent children or the children who are able to afford are able to go online, do activities? What about the refugee children? What about children who are not having those kind of facilities? From the child rights perspective, where do you think COVID-19 situation is right now?
Well, I think it's terribly difficult because although Wales has a devolved government in the UK, so the decisions made by Welsh government are not necessarily the same as those at Westminster, or indeed result in the same practices in Scotland. And I think it's probably important we understand that. So in Wales, for example, for education purposes, the minister has ensured that there is online support available to every child and every family. And in relation to that, of course, you're still going to get the diversity that happens because some families are bound to have more access or greater access to IT than others. It doesn't help, of course, that in Wales we have a very inconsistent access to the web anyway, because it's rural and probably shares that with Scotland. So we have availability should people be able to access appropriate resources. But of course, when we're talking about early years and childcare, it's something quite different, because our childcare organisations have been asked to close locally, for example, and there is just one locally open as a hub. And while that's great in some respects, it does mean that some children, if they have to use it because they're being asked to use it only if it's absolutely necessary, then what it means for those children is they're going to be looked after by carers that they don't know. So they're going to have this enormous change of being asked to stay inside. The family has to isolate with the household. It's not, as in some countries, a bubble impact where you can have extended people there. It's just the people that you live with. And those children are going to be staying inside with just those people. If they're having to access daycare, it means both parents are, or what if it's a single parent household, one parent is likely to be working and under great stress. And that's what worries me from an on the ground point of view, in addition to the fact that I don't think it's going to be very healthy that despite the fact that government are paying for furloughed staff and some other access for support, there's going to be an awful lot of childcare providers out there incredibly stressed. I know they are. In fact, I've been talking to a number of them and supporting them, who wonder whether they're going to be able to reopen. So it's not just about now, it's about the future. The difference in Wales to, for example, England, is that most of the childcare providers are single site organisations. So when they take that hit, it's going to be enormous, and it will have such impact on the owner and the family of the owner. That's going to be so stressful for those. But in terms of policy work, what's it done? It's actually interrupted what's a very exciting time in Wales. We're just about to start work on a revisioned early education and childcare rollout of something very different, and that's sad because that's so related to child rights and a child first premise that it's going to be built on. So that's had to be stalled, and I'll be chairing that, but it'll be a little way into the future. And also it stalled the work of a revisit of a Welsh Government parent expert advisory group that I also chair. And that work, while it's going to be so needed now for the sake of children, is going to be stalled because people just can't continue the level of work we were doing online. We really need to be able to get together, and we need people to be in place at work, and they're not now. So that's going to impact on children. For children's rights to access to environment, I've heard that about nature. That's going to be divisive, not by monetary income, but by access to an area that's good for outdoors. That doesn't necessarily go hand in hand with affluence or poverty. And then, of course, we've got the fact that children who are living in poverty, particularly in the valleys in Wales, who are going to be enormously hit, because stressed families are not going to be able to really access what's available for them in terms of education, to be able to implement it effectively. It's an enormous ask of parents who are stressed, even if they're at home. And if parents are at home and they're working, to be able to ask parents to work in times of crisis at the level they may have done if they're in the office, while they're looking after children, while they're under stress, is huge. So I think we're really going to need after this something very, very positive for families under stress, whoever and wherever they are.
True, very true. I'm going to ask now a couple of quick fire questions. So you'll have to keep your reply a little brief, all of y'all. This goes out to all of y'all as a common question. My first question is, when do you think normal life as we had known it is going to start? By which month? Laura?
Oh, goodness me, that is a $50 million question. I seriously don't know the answer, because yesterday the government made an announcement we have another 3 weeks of lockdown. And in my head, where I'm looking at, I am actually thinking autumn, because there's so much, I think, as my colleagues have, I think Karen alluded some really good points there, Karen, about the anxiety and the stress and the...
By when do you think, which month? Do you think this year or next year? By when do you think it will be normal?
Late autumn, early 2021.
Okay, Claire? Claire is there with us? Okay, I'll go to Stephanie.
Here
too,
you
Claire.
are. All right. So I would say, if the question is when will it end, I would say September, into the autumn in the UK. And I wouldn't say that many people would be really through the trauma of this for years. But I would say things may happen, as Laura just said, in another year's time, 2021.
Wow. Stephanie?
Yeah, I mean, I think that what's normal going to be? We've been told, and I think it's likely that it's not going to be turning on the light switch, right? It's like more of a dimmer. So it's going to vary. It's probably going to vary by state. I think that hopefully by the fall, there will be some semblance, but I do know that some colleges and universities are already planning to do online in the fall. I think for me, getting back to my normal would be international travel, which I generally am on a plane at least every 4 to 5 weeks. And I don't think that's going to happen again until probably next March or April, to be honest. So they're saying until we have a vaccine, and that's just probably not going to happen. So
Sam, what about you?
Yeah, I mean, so we're being told that schools aren't likely to go back to normal for at least 3 months, maybe 6 months. So from that perspective, just in terms of families managing that work and home balance is tricky, and the funding arrangements for early childhood, which kind of force services to operate at a lower capacity, are definitely in place for 3 months. But I would agree with others. I don't think we'll be travelling internationally and getting back to, a full kind of normal until sometime next year.
Karen, what about you? What do you think? When is the normal going to be normal?
I think we'll start to see some elements of that September, when perhaps children go back to school, and I think it will be a staged response. So I think it's going to be well into next year before we see everything as free flowing as it may normally be, and that might even be the end of next year, beginning of the year after. But economically, the impact, I think, is going to be felt for a good few years.
Wow. My next quick fire question to all of you all is, do you feel early childhood education the way we know it, as in children in a group in a classroom with teachers, do you think that's going to change? Do you think there are going to be too many rules and regulations around health and hygiene, which may make the caretaker's job more and more difficult? What do you feel about the scenario when we open? So I'll start with you, Karen. What do you think? Do you think early childhood education as we know it is going to change forever?
No, I don't. And that's because I think that for young children, relationship building is so important. And that's something that parents need to be focusing on now. When they're incredibly stressed, they forget everything else. If you need to focus on parent-child relationships. But I think because of the centrality of that, and because of the way operations are set up, it's going to be really important to get children back together and allow them to play together, build relationships, and to access exploration of whatever environment they're in or taken to consider that children may spend too much time in the future at home and online is just too difficult to get my head around. But I also think that we will all have a huge responsibility afterwards to help parents bring that balance back, because I think it is a balance, and I think it's our job to help them do it.
Stephanie, what about you? Do you think there will be massive changes, bigger changes that we will all have to work around?
I don't. I think that the core of early learning is still, the science and development tell us that it's so important that children have the opportunity to socialize and do exploratory work together. And that requires that they be in groups. That said, I do think that it will change policies around our educators and making sure that they are not feeling pressure to work when they're not feeling well, and that we better support them, and that this is doable. We just need to be more vigilant about ensuring the health and welfare of educators.
Oh, wow. Sam, what about you?
Yeah, look, I think there's a couple of ways. I mean, I do think we'll get back to a normal in terms of children attending services, but I do think that this is an opportunity to reframe the relationship between educators and parents and the flow of learning between the home learning environment and services and centres. And I think we really need to embrace that opportunity to have that conversation. I think parents have a new respect for the work that educators do, not just early educators, but educators and teachers. And I think educators and teachers are realising too, goodness, we need to find different ways to support quality learning in home environments and to help children connect in other ways when they can't be together in groups. I think it's also transformed the world of digital learning and being online, and there's quite a positive about that. It's not just screen time. Nobody is suggesting that children are just left with a screen at home and that's quality early learning. And I mean, that's a good improvement in some ways. Nor are people saying there's no role for digital technology in young children's lives anymore. We're not hearing that anymore. I think we're hearing now we have to use technology properly. We need to use it well. We need to know how to support good learning that happens off the screen, but via the interaction that an educator might have with the child and their parents through the technology. And so I think there's a great opportunity to talk about that and what it means for educators and service managers to be connected online, to do professional learning online, coaching and mentoring and other things, which for us in Australia, there's been a real resistance to that in the past, but I think people are now realising that it has a place and that there is a value to that, and that you can still be connected to your peers and your colleagues, and you can get
Claire, what about you? Claire, do you think things are going to change?
I think for me, all the stuff we've already talked about in terms of relationships, but with the nature-based head-on, I think human beings have realised they don't control the world. I think a microbe does, a virus does. And so actually, I'm seeing more humility around people realizing that they can't keep on destroying the planet. So in terms of my lens, in terms of sustainability, in terms of our engagement with the natural world, it's been a hard lesson for many people to realize that there are parameters for our behaviors. And so actually, I've had more people contact me about embracing sustainable education, not education for sustainability, a different framing of that, which says, how do we make an educational paradigm that is sustainable, that supports children and the planet to flourish? And so that makes me feel very positive about us moving forward.
Absolutely. That's a fantastic point you made, Claire. Very, very valid. Laura, what do you think? Do you think early childhood education will change in the future after COVID, post-COVID? Is Laura there?
I'm here now, sorry. I had to unmute myself. I think this is an excellent question, and it's going to give us globally an opportunity to press the pause button and have conversations around what have we learned from COVID-19? What is in the best interest of children? How can we keep children central to our discussions? I've had many of my global colleagues messaging me, email me, Zoom calls, saying to me, what professional development can I put on from when we start to go back? And for me, it's what do we need for our children? The children always must come first. How can we support parents? How can we support the educators and teachers? From a leadership point of view, how can the leaders support the teachers and educators to come back and work with children? And so the main focus for me is, I think we need to strengthen some of the good work that we've already done within early childhood, and then look to the future, how we can make it even better with research, with evidence. And some of my panel members I know have done some fantastic work in their own field, and keep on having these conversations. And maybe we can come back every month and have conversations like this and bring on other people as panels to think, how can we make it even better for the little people of the world?
That's a wonderful point, Laura. My last quick fire question is a little like a googly, because and I think except Stephanie, everybody comes from a cricket nation. So for Stephanie to understand a googly, I hope baseball also has a googly. But my question is, from now till September, because we are all saying schools may not open till September. From now till September, we are going to be teaching two things to these little children. One, social distancing, which means stay away from others, which is so contrary to their social emotional development right now. And number two, we are telling them school and learning are digital, online. So even though everything is not online, but naturally right now, most of them are seeing their teachers or the work, etc. online. So these are the two things that are shaping their world right now and will shape their world till September. When we reopen in September, how will we take them out of social distancing and being addicted to online learning? So Laura, let's start with you.
That's another excellent question, and I think it leads on from our previous point. I think for those first few weeks, whenever we go back in our respective countries, either to schools or daycare settings, those first few weeks have to focus on children's personal, social, and emotional development, not on actual attainment. And the wonderful work that my colleagues do, especially Claire, outdoor learning, having conversations with children about what's actually happened. We know from what history tells us what's happened in the Second World War with children in the UK and other countries who were evacuated, the impact that that had on them in terms of adverse childhood experiences. We now are very fortunate. We have research that tells us the damage that previous pandemics, wars have done to children. So let's use this research to, I think, press the pause button, not be rushing back, take a nice slow pace, going with the rhythm and the flow of children. So yes, we know there's going to be children who will be damaged. We know already, probably in other countries, there's a huge outset that's happened with regards to domestic violence, children who are being abused at home within lockdown. So let's support children. I always come from, what is it like for a child? And this is what we need to be basing our work on to make sure that they come out of this as best as possible.
Karen, what about you? Social distancing and online learning. We are almost going to get them addicted to these two words. How do we then come out from that in September or post-September?
I echo what Laura said. We need to do this gradually. It needs to be along child first principles. We need to allow it to happen organically. We need the opportunity for children to get together, to just enjoy being with each other and to just start from where they're at. We don't know what experiences they've had at home. Some children might have had very good, very positive experiences. And for those children, and for the majority, we hope it will be a time that they will remember that they've spent with parents and with siblings,
Yes.
building relationships, having an hour out a day, doing something nice, getting into their local environment and exploring where the natural environment there. And it's been very positive. But within that group, there's going to be an enormous amount of children collectively who have had very difficult and dire experiences, who have heard dreadful things, who have lost friends and family members, and who will have been very, very stressed by the experience. So we need our practitioners to be supported, to look out for children with issues, to have resources and support available for them. And so again, a stepped and staged approach where we understand the needs and rights of every child to feel confident and secure in their home, as well as at their place of learning, wherever that is, and to make sure that the lived experience they have now is as positive as can be, because that's what's going to shape their brains to take them forward. We need our children to feel safe, secure, loved and cared for. And if we don't do that, they won't be in any position whatsoever to learn.
Absolutely, absolutely. I think we need to keep learning on a back burner, especially in countries like ours, where right now people are more worried about whether children will be able to learn to read and write because there is no school. So I think that's a very valid point that you made, that practitioners will have to play a bigger role in understanding individual needs of the children who come, As Claire said, there has been a rise in child abuse during the lockdown all over the world. Globally, children are being abused more now that they are constantly at home. So Sam, coming to you, what do you think we can do? How do we take children out of this conditioning of social distancing and online learning when schools do open post-September?
It's a great question. Look, I think one of the things we can do as early childhood professionals is to lead some of the conversation with the public and with families around what is important in early learning, because I think what we're hearing is a lot of, as you've said, Swati, panic about, oh, children are going to miss out on a year of reading skills or a year of early numeracy, when actually what children are really missing is time with their friends. And what the most important aspect of early learning that we're losing during this lockdown period is that interaction and engagement and building relationships with other children. And so I think we need to help settle down families and settle down politicians. We've got, you know, our own Prime Minister out there saying children must go to school because they can't afford to miss out on education, and that's being translated into, you know, sitting children at the dining table for 3 hours a day to drill them on their times table, rather than understanding how much of education is really about inquiry and engagement and communication, some of which can still happen online. There's actually really, children are actually quite good at staying socially connected online, even when they are physically they have to be physically distant. And I think we need to try and convey that, you know, and play a leadership role in that conversation and say what children are really going to want to do when they get to come out of lockdown is to be together, and to be outdoors and to play. And the play is going to be the most important thing. And that the amount of instruction that is required by parents of very young children is not as high as people think.
Right. Stephanie, what about you? What do you think? How will we get children out of this huge conditioning that they've gone through, that stay away from people, keep your distance, don't touch people, and online learning is what many of them may have just started on and got really comfortable with, and now we put them into a classroom. How will we get them out of this?
Well, I mean, I think recognizing transitions are hard, regardless of whether, you know, they had a great experience when they were at home or a more difficult experience, that everything we know about transitions for early learners and sort of supporting them through that process and giving them time to really adjust and recognize that it's going to be a little different and should start a little slower. I think, you know, everything that's been said about play and what we know about how young children process and giving them many opportunities to do that in different ways will be really critical. I think that also recognizing that this has been traumatic, right? That this is, you know, for many children, this has not been good and this has been very scary. And so I think there's a lot of interesting research on how to support children through processing trauma that should also inform that work. We're actually, our young children journal this summer is going to be on trauma. And I think there will be some interesting tips there, but just recognizing this is going to be a transition and sort of supporting educators and children and families back through this, because it's going to be a transition for everyone.
Very pertinent points made by all of you all, really. I have a question here from Mr. Ashish Bhatnagar, who is the principal of the International School of Seychelles. And his question is very valid and pertinent to all of us right now, that many schools have gone online. Many kindergartens are also giving children stuff to do at home so that parents know what to do with their children, because many parents are clueless what to do with their children for 24 hours. So a lot of kindergartens globally are giving them work online, engaging with them online. It may not necessarily be the reading, writing activities, but they are activities of games and play. But personal touch is missing. Children are missing that personal touch. So do all of you have any idea how schools can increase the personal touch when they are trying to engage with children who are right now at home and not in the childcare facility. We'll start with you, Stephanie.
So I think, I think it's a difficult one, right? But I do think that the opportunity for young children, if they have access to technology where they can share their drawings or sort of share personal stories of what's happening at home, is a way to sort of get that connection that's very concrete and real for them. I've seen some really great things going on Zoom, even with 2-year-olds, where they check in for a very short time. I mean, that would be one thing I would emphasize. We shouldn't be expecting children to be on Zoom calls for long periods of time, but short check-ins are really nice if that's accessible. And so, you know, I do think it's going to be hard. I've also seen some wonderful things in neighborhoods where they're putting in the US will put up, for example, I think it was teddy bears in the windows. And then families, because we're allowed to walk here, they go and they count the teddy bears, and that's sort of a way to connect with neighbors and others and from your porch. So those are a couple of things.
Oh, wow, those are some wonderful ideas. I especially love that about children sharing their stories about what they are doing at home. If they can talk to each other and share those, I think there some amount of a little personal touch would come rather than just engaging in some activity. Claire, what about you? How do you think we can keep up the personal touch if children are not in the schools and schools are actually trying to give them online learning?
I'm just can I answer the previous thing, because I never got my little chance to speak.
Oh, I'm so sorry I forgot you. I'm so sorry.
Social distancing.
Together.
One of the things I think for me is that I think going back to the analogy of the raft is that I do think it's about the reconciliation, the recognition that this is tough, and actually not expecting it all to go back to Shangri-La, but to say, yeah, this happened and this is how it felt. And the affirmation bit that I've talked about before is that, you know, it's okay and it's different, but it is going to be all right in the future. And that forward thinking thing, I think, comes in answer to your question, your current question, is that the personal touch is about the relationships that Karen talked about. And I'm on this webinar with you, and we're thousands of miles apart, but we are having that verbal connection. So my thinking is between people is a sense of what I would call emotional resonance. And you can convey that resonance, that relationship with each other through a screen by having a common bond, whether it's a common bond of holding up a leaf or a twig, or me talking about going for a walk in the forest, or you showing me a teddy bear. It's an object of transference that allows us to connect, whether it's in the virtual space or in the physical space of a playroom. And so the forward thinking is that we're going to get back to being together, which is the T of the raft. And so I think when I do see this amazing community connections, when I see people having virtual rooms, virtual storytelling, that's people seeking that emotional resonance, that love and connection that we have as a human species.
Wow, I think your raft is something that's going to be a takeaway for all of us. And you always need a raft when you are in uncertain waters. So that's a wonderful acronym that you have there. Laura, what about you? How do we give a personal touch when we are now exposing our children to online learning?
I think I agree with what the colleagues have said so far. There's many things that we can do from video conferencing, etc. But I recorded something the other day for an online network for young children, and one of the things that I was sharing was about collecting special things. So if a child has either an old shoebox or an old container, to think about special things like, you know, the film The Sound of Music, a few of my favorite things. So in this box, I had an old crochet thing that my grandmother had done, a special maraca thing over here that a friend brought me back from Ghana to put in there. So if we were able to fill box with all these special things and to have conversations with our children about these transitional objects that I call them, that we can't see these people currently, but we can hold them dear to the heart by the special objects. The jewelry that I wear is, you know, from my grandmother, which the children's series is based on. And I think it's, for me, is we get bombarded by all the negative information, how many people have died, and children are picking this up. I think we need to, as much as possible, to park that and say, yeah, this is happening, but let's think of all the lovely positive things that we have that we can hold in our memory. So when the children do go back, the educators and teachers can say, well, talk to me about all the special things you did when you was at home regarding the connections.
Wow, that's wonderful. Absolutely. In fact, there's one thing that we are doing is when we are holding Zoom sessions or we are doing rhyme sessions with the children, we ask the children to get a musical instrument or anything that they have in the home that can make a sound and join in the session, so that everybody, all the children can see each one holding a different object, and it becomes more personal, and that's how we take everyday activities to mean something for the children. Karen, what about you? How do we bring that personal touch in the online learning space?
I think the online learning space brings fantastic opportunities to connect the teacher or early years practitioner and children. And early years practitioners, teachers, there are two things that they have to their huge advantage. One is typically a great individual knowledge of that child and family that they can use to their advantage. And two is a really good understanding of communication, that's verbal and non-verbal communication. So if they can find just short periods of time where they can talk to an individual child and recognize what's happening with that individual child, give that child a voice. Remember to call the child by their name, so they're not just addressing a group. This is about just a few seconds, perhaps, of individual time and recognition that that child matters. That's going to go a long way. And it's actually going to help build a rapport and a relationship that will see them through, hopefully, until they return to the classroom or the early years setting. And it's equally important to try to take advantage of that time to build relationships with families. So if parents are about or siblings, they could even bring those into the conversation. And so the child doesn't lose the connection with the school, but the school uses that as a really good opportunity to build better relationships with families and give that child just a few more seconds of individual sense of, you really, really do matter to me. And typically that's what early years providers do very, very well. So build it, use it, utilize it.
Yes. Like, you know, in our UAE schools, they have the circle time song, which says, we have Karen with us, let's all clap for Karen. We have Laura with us, let's all snap our fingers for Laura. So I think when even in the rhyme sessions, if you take each child's name like that, it does give them a personal touch that, wow, my teacher knows my name, or she's referring to me by the name. This is so necessary. I think Sam hasn't got a chance to answer this question. Sam?
Unmute. Yeah, look, I think all of those suggestions are fantastic. I've been writing a lot of them down. Some of the fun, playful sort of stuff we've seen in Australia is educators making TikTok videos and playing those on social media and naming the children or talking and things that are unique to their centre, you know, doing a dance or a song or a story time where the children can see they're a familiar educator in a familiar setting. They feel connected to that. They're very short. You know, they usually run them on social media platforms so parents can grab onto them. The other thing I would say is I've got teenage children. I've had higher quality conversations with their teachers during the lockdown period than ever before in the high school years, because the teachers have the time to call and to say, look, you know, I've got this assignment, but I'm not quite sure how that's going. And I think we could do the same in early years. If we have teachers who are working but have more time available to pick up the phone and have that conversation with parents, and also to help parents navigate. I know at ECA we started early on saying, oh, we'll gather all the virtual links that parents might use while they're supporting home learning environments. Then we realised that is hundreds of thousands of sites and you know, museums and zoos and other things, and it's just ridiculous in terms of volume. But what educators can do very well is know that that child has an interest in pandas, and this zoo has live pandas every day at 10, and so let's connect this child with their interests from what's available on the web. And I think that's incredibly powerful in terms of building relationships between families and early childhood educators, and we'll build the respect of families for early childhood educators as well.
Absolutely. I love the idea of calling up each parent and speaking to each child. I think that's doable for everybody. You know, you don't require great resources for that, but it really makes that child feel so good when you receive a call from the teacher and you're now chatting with the teacher. Amazing points, really. I think we should make, Ravi is going to be compiling all this into an article, which is going to be published in School News magazine, and everybody is going to be getting that link. Have I forgotten anybody in this question? Because I get so engrossed in all your answers that I may miss out somebody or the other. Have all of you answered this question? Yeah, I take that as a yes. I go now to my next point, which is your advice, your 1-point advice that you would like to give to educators around the globe about this crisis and how to handle it best, keeping children at the core or at the middle of everything that's happening. One piece of advice. Sam, we'll start with you.
Oh goodness, no pressure. I think it's to look after yourself and know that we're all in this together, and none of us have been through this before. So nobody's got the solution. Nobody expects everyone to get every decision right. Give yourself a break and take care of yourself. But at the same time, I think if you stay true, as somebody else said, stay true to that core purpose. It's all about the children. What can we do to look after the children we're responsible for? Then we can't go too far wrong.
Absolutely, absolutely. Karen, what about you? What's your one piece of advice to early childhood educators around the globe? Karen?
Yeah, sorry. Maintain that balance. We have to keep children's rights at the forefront of everything we do, but at the same time, remember that you are not just working from home, you're working from home at times of crisis and stress. So look after yourself, look after your family. And if you do that, then you're going to have the opportunity to have the resource to share and to give to others. So do everything you can to maintain that balance, and don't expect you to be more superhuman than you already are.
Yeah, I think that's the mistake many of the educators are doing right now. They're trying to do everything and trying to be the best at everything, and they are getting exhausted. So that's a wonderful piece of advice. Stephanie, what about you? What's your one piece of advice going out to all early childhood educators?
I would say just to recognize the importance of their work. That during this time, it's really put, again, the spotlight on how early educators are working just as hard and have the same stresses as educators of older children, who often get more recognition and better pay. And that this is a time to really recognize how critical the work you do is, and that to advocate for yourself, that when we come out of this, we can come out stronger.
Absolutely. I think many people will say, agree to this, that I think parents around the world during this crisis have really understood the important work that early childhood educators do, especially those parents who are now with their children 24 hours a day. They are actually going to be very, very happy when they see the early childhood educator. So Claire, what about you? What's your advice?
I'm gonna really quote my mum, and my mum used to say to me whenever I was a bit fed up or in a state of flux, she used to just look at me really calmly and say, you know what, time will pass, good and bad. And I think that's the bit you need to hold on to. This won't go on forever. That we need to accept that this is tough right now, and everything everybody else has said on the panel, but there are good moments, as Laura had said, and they are moments that we need to hold on to and cherish. And I think that means that we have the opportunity to really reset. We've got a reset button here. It's about us reflecting on our own values, who we are. We've actually got time to really think about who we want to be when we emerge out of this, and it will come, that moment. And I think that would be my advice, is embrace the time you've got, think about who you are or who you want to be when you come out the other side, because yeah, you have that reset time now, that chance to become something new if you want to do that.
That's a wonderful, wonderful piece of advice, Claire. Reset button. We've all got a chance to reset our buttons. And I think that's what we should be doing during this time also. Laura, what about you? What's your advice going out to the early childhood educators?
Excellent points from my colleagues thus far. For me, it's the number one thing. It's the aeroplane analogy of putting the mask on ourselves first. So we have to take care of ourselves, self-preservation. As Claire said, pressing that pause button and not be rushing to do everything, because I get into habit, I must do this, I must do that. So it's a note for me as well. And I think one of the things that is really important, many of us are suffering with anxiety, myself, if I'm honest, if I have a little bit of vulnerability to share that with everybody. And I would say it is okay to be feeling fearful, to be feeling sad, to be feeling frightened. Allow those feelings to come out. It's really important. But one thing I say, but make sure you bring your passport with you to check out, because we can't be any good to our family, friends and colleagues and to the little people if we don't take care of ourselves first, and then we can pour out to others, to give to others once we sort ourselves out. So thank you.
Absolutely. I have a piece of advice for the educators, and we've made an acronym of the word COVID, because COVID is something we as educators and parents are keeping on hearing again and again. So I have an acronym of COVID. C stands for care, which means take care of yourself, which is what all the participants have said. O stands for bring the outside in, which is what Claire loves to do, because children are right now missing their connect with nature and the outdoors. So try as much as possible to bring the outside in through nature activities, through any kind of activities, helping children look at the stars, etc., watch the sunset, sunrise. So bring the out in. V stands for virus. Yes, children are hearing a lot of things about the virus. So it is very important that you talk to children about the right things about the virus. And UNICEF has some beautiful guidelines, which today we at ECA India have converted it into a poster, and we're going to be putting it up on Facebook. I definitely stands for intelligence quotient. And yes, children need to be kept engaged in activities that are relevant to them, that are important for them, and that are age appropriate. That's most important. I think Stephanie and NAYC always talk about DAP, and that is what's required here. And D stands for, many of us, we think of death and difficulty when we think about COVID. Well, D also stands for doing. So it is up to you to do the best in these difficult times to come out of it. So it's very important to empower ourselves with this acronym of COVID, which is care, bring the out in, virus, talk about it positively, give children something to know about the virus. I is your intelligent quotient, which means when you do the activities, think about that. And D stands for doing. Please do everything to keep yourself safe and healthy. Ravi, how much of time do we have left now?
None.
Oh, sorry. Okay. So I'm going to wind up now by giving you all the listeners, especially those in India, an idea about how we're going to engage in the future with all of these lovely ladies. Karen is initiating a child rights project that ECA and Podar are going to get involved in, and we're going to do a huge child rights project in India. With Sam, we are in talks about a leadership program which is online. So that is something we are in talks with Sam, Early Childhood Association Australia. Stephanie, NAYC also, we are in talks to get some kind of online workshops here in India for the educators. Claire, we have already worked with her, and we are bringing a nature kindergarten or a nature training course which is again online, and I think it's going to be starting from next week. And Laura, you are the only one that we still have to work out how to do more with you now, maybe something to do with your grand series, but we are going to be reaching out to you. And to all the educators and friends globally listening to this, after the Second World War, there were a lot of changes in early childhood education, both in the work of Reggio Emilia and in the work of Pickler. We are hoping that after COVID passes, some new changes, something new will come out in early childhood that's going to help take our educators and children forward with positivity and with help. And my last request to all 5 of you is, how about we come out, because we are all part of an association in some way or the other. How about if all our associations come forward and draft some guidelines and send it to UNICEF, that these are the guidelines that we feel that educators and parents should implement post the COVID situation once the early childhood centers open. This is an initiative that we can all take in one voice, so that children wherever in the world would gain by these pointers that will be drafted. So I will be sending out an email to all of you all, and I hope you will all be in this with us, because I think right now what globally the world needs is to take care of its littlest citizens, because they are the ones who are suffering the most in this crisis, because they are the ones who are not understanding what's happening. And when we reopen for them, they are the ones who are going to be wanting the best care, support, and love from all of us. So thank you. Thank you, Laura. I know you are unwell, but you still joined us. Thank you, Claire. I would love to come and visit your forest kindergarten very soon. Stephanie, looking forward to starting the online course. Sam,
Thank you.
We missed you in February, but we are looking forward to starting the leadership program with you. And Karen, child rights is what is uppermost in our minds right now, and should be uppermost in the minds of all educators when they are taking decisions of online learning or what to do for children or policy making, etc. I think you will join me in saying that it is child rights that we should all be thinking about, and not pleasing parents or pleasing us or pleasing policymakers.
Yeah.
So thank you to each one of you. And thank you, Ravi, for hosting this session. And over to you, Ravi.
Thank you very much, lovely ladies. I just did a poll where 96% of our attendees says that they approve of the content in the selection of speakers. They say it's brilliant. 4% of they say could have done better, because I didn't shave, so I think that's towards me. And none of them said nay. So I think with that, we should also talk about the assessment, which is out there and open. So we did a great job. Thank you, Professor Karen Graham, for joining us. Thank you, Sam. Thank you, Stephanie. Thank you, Laura. Thank you, Claire. Thank you, Vinay, for all the help that you provided towards this webinar. And Mother of Early Childhood Education India, Swati, thank you very much. So let's all keep safe. Let's stay indoors, and let's look forward to going back to school again. I think that phrase is pretty much trending all over the internet. We want to go back to school. A lot of teachers are doing that. And do follow School News and Early Childhood Association Facebook page, because all the recordings and the story that Swati mentioned that we are going to publish by tomorrow will be available over there. And in case if you are looking at any consultation or any email IDs of any of these amazing celebrities from various parts of the world, please do reach out to us at info@schoolnews.com, and we'll be happy to share their email IDs with their permission. And I think it's evening here in India, and a lot of people are chatting in the chatting screen that, it's midnight in some country, it's 6 in the morning somewhere. And all thanks to you beautiful people who actually put that on your alarm and kind of, wake up that early, or, when you're waking up that late. So thank you to all you amazing people, and goodbye. Yeah.
Thank you for everything.
Bye.
Bye.
Bye. Thank you.
Cheerio.
Bye, thank you.
Thank you. Bye bye.